right, everyone. Hello, hello. So I'm so excited to talk to you all today about this topic. I think many of us have observed this connection between TikTok and social media and mental health content and how our clients are understanding themselves and coming to us and having these discussions. And so I thought it could be cool to really look into the research on this and think about how we might resolve ethical conflicts related to this topic. So that is kind of what prompted this talk. So we're going to get into, like, what does the research actually say? Because obviously it seems like a lot of this is anecdotal and we have this experience. So what is some empirical support for these connections and what we can do as clinicians to best support our clients. I selected kind of an ethical framework for looking at this because I feel like there's no clear right or wrong or steps to take that is going to work for everyone in every situation. So framing it based on ethical guidelines and priorities or decision making seem to make sense. And then we'll also talk a little bit today about the ethics of us using social media or interacting with it in terms of our clinical practice. And so obviously any of these topics I feel like could be an entire talk in and of itself. So this is definitely more of an introduction and setting the scene. And I have a ton of resources and references that I use in this talk. So I encourage you all, if you're really interested in this, to take a look at those. And who knows, maybe we can have a follow-up. Yeah. If you think that's interesting, let us know. Some disclosures, no really conflicts of interest. We already told you where the funds are going. And just a note about limitations, there's some pretty limited research on like this exact topic, like TikTok and mental health. There's some stuff that we're going to go over, but sometimes I kind of borrowed a little bit from, social media or internet more broadly. I went a little bit outside of mental health and looked at medical diagnoses overall. So I'll kind of note when discussing the research what topic specifically it was looked at. So I thought I would introduce by just showing some examples. Like, I'm not sure what the audience familiarity of TikTok is. And so I have a compilation. We're not going to watch the whole thing, just a couple minutes just to like get a feel for what is it that the people are seeing. So yeah, as you can see, there's a variety of ways people share this content on TikTok, and it can vary from just sharing personal experiences, having tips and tricks. It could vary from saying like, oh, here's some things that are associated with it. They're using sounds, they're using humor, and it's just kind of a lot. And it's not really clear who these people are and what perspective they're sharing, and is this information verifiable or not. And obviously us looking at that can look at me like, okay, like I see how some of that makes sense, and like I don't know if all that talk about the different nervous systems is totally accurate, right? So like, but as just an average individual, it's unclear. So other things about TikTok that kind of contribute to this phenomenon is that it is algorithm based. So if you look and like specific content, it will show like even more of that type of content to you. And so each individual's page might not be at all the same depending on what small groups there are. And I thought I would just also throw some stats on there about the engagement with TikTok and how many people use it or have ever used it or use it regularly, how much time people spend on it. And this kind of varies. Some focus on just adolescents and some focus on just the user base overall, which is primarily younger people, but there are individuals that are, older than young adult. I'm on there, so and a young adult. So maybe I'm too old for TikTok, I don't know. But from the clinician perspective, what feels like, that I'm seeing, or our clinicians here are seeing, other people we talk to, or just in the consultation world in general, we feel like there's these higher rates of individuals presenting with these diagnoses that may or may not align. And they have really studied and increased vocabulary about these things. And so sometimes that can make it challenging for assessment and diagnosis. And we might wonder about the validity of some of our testing procedures due to like strong attachment to these labels, biases, potential secondary gain, concerned about overdiagnosing. But also on the other side, we have clients that have increased participation in their care. And so I wanted to just kind of pause here and hear from you. You could put in the chat, what has been your experience with this? Like, are you noticing that there is this increased rate? Like, are there certain trendy diagnoses that you come across all the time? Or what is your struggle with this? And put it in the chat. Oopsie. And then we can view it together. So yeah, type in the chat. What's going on out there for you? Tics and DID, autism, but also an observation that the criteria might be flawed, bipolar, borderline, DID, autism, ADHD, absolutely deal with it regularly. People having more curiosity, personality, attachment styles, so not even just diagnosis. Personal life, atypical, identity-based, yep. The intersection of gender diverse, neurodiverse, over-pathologizing, catch-all terms but not specific symptoms, toxic relationships, that's a fun, yeah. So we're seeing all these buzzwords. We're seeing all of these diagnoses. People are trying to find diagnostic labels or things to explain common problems, or is it pathological? Is it not? Is it just normal? Right. Terms that are incorrect or made up. Yep. Yeah. Love that. So we got a variety of things. I'm going to kind of move on. Yeah, feel free to like continue putting stuff, but I was just kind of curious what everyone else's experience was with this. But what does the research show? So yeah, as I said, this is all anecdotal evidence. What does it show in the literature? There's this one example that I thought really captured each side of the issue really effectively. So these are two papers that are describing the increase of tics or functional movement behaviors disorders and connecting it specifically to TikTok. And so there's one paper that has a pretty clear viewpoint message of stop that and describe it as a sociogenic illness or like a mass hysteria essentially. And they connected the popularity of a specific content creator with tic-like behaviors and noticed timeline-wise their referrals increasing significantly and those specific behaviors that that content creator had were presenting in this population. And they have a stance of cautioning against potential attention-seeking behaviors, secondary gain, the concern about the overutilization of like healthcare resources. So that was kind of one paper. And then there was a response paper, which, you know, when people in academia like fight, it's kind of fun. They're like, response. And they say a call for caution that the stop that rhetoric really threatens research, healthcare advocacy. They critique some specific research methodology in that paper. They have some concerns about invalidating the patient experiences and feel like this overall sentiment of like, this doesn't fit the criteria exactly how it should be, misses cases that maybe the criteria is not great at capturing, which we know that exists. So I wanted to go through each of these perspectives in more detail with other supplementary research. But I've linked these articles in the resources at the end of this talk, so I highly encourage you, if you're interested, to read them. They're both very interesting. So let's talk about mass sociogenic illness, aka mass hysterias. These have been documented as early as the Middle Ages, attributed to things like spirit or demonic possession, or, you know, like maybe they all poisoned themselves on accident, we don't know, but essentially there's this symptoms that affect a certain group, and they have a few common characteristics. They're like rapid in onset and recovery. They do impair your functioning. There also seems to be a high amount of anxiety associated with it and distress, and there's just like this unknown organic cause. And it affects, like a more recent example from the Middle Ages, for instance, has been things like, you know, Havana syndrome or Gulf War syndrome from certain military populations, of like, well, there's all these clear symptoms happening, but we're not quite sure what this is. So then when you apply that from a social media perspective, it's a little bit different in that it's not really restricted to a specific location because it allows, the internet allows for more global spread. Research has associated this phenomenon with fear, COVID-19, big one, surprise, surprise. And then they also have a couple papers associating it with eco-anxiety, particularly in younger populations. So people having fears about climate change and like the end of the world. And then when that happens, there's like maybe more of these types of group behaviors. There's a term called social media associated abnormal illness behavior, which like, what a mouthful, but that will capture both involuntary and voluntary symptoms of like people doing this potentially intentionally on purpose to get some type of outcome. However, most research on this particular model emphasizes that this is not faking it, like these are real symptoms that are presenting and the behavior might not be totally conscious. And so sometimes these articles and stories about this research or about this phenomenon contribute to that stance that people are making it up, but there's not a ton of evidence to suggest that they are empirically. But speaking of the evidence that does suggest that there are some people that do this. So there's fictitious disorders or Munchausen's by internet. I was wondering all these terms, who comes up with these? This phenomenon has existed since the internet, early days of the internet. The earlier articles about this talk about this was popular, you know, when blogs were becoming kind of a thing, and people were allegedly making up cancer diagnoses to get like support, you know, documenting their experience and getting the support and validation when they didn't. And it has been seen in other spheres of social media, kind of like previous to iterations of TikTok, like on Tumblr or other spheres where there's a high eating disorder prevalence in communities there, or suicidality in communities there, which actually TikTok does a pretty good job of limiting that type of content. They have some pretty strong censors with disordered eating or suicide talk, where they actually like block even like the words that are used. So sorry, I got a message that there were boxes on the top of my screen, and I'm not sure if I can get rid of them. So I'm going to try for like a second, otherwise I might. Oh, I did it. Okay, so sorry about that. Now hopefully that is like less distracting. Then in this space, they talk about the voluntary reasons could be things like increasing views and followers or selling merchant services if it's like from a content creator. But we have to think about secondary gain more broadly. And that could include things like not having to engage in certain responsibilities or things that feel really overwhelming, like it's an avoidance behavior potentially, or a connection seeking behavior potentially, like wanting to fit in with a group or find a group, have an identity, elicit support from others, you know. So there's a lot of reasons why that could be a motivating factor, but again, there's not a ton of evidence in the research that says that that's like what's happening, just like overall. Then from the response paper side, they kind of hold up the side of empathy and empirical methodology when examining this phenomenon, is that first of all, there's limited evidence to support causality. We don't really know that TikTok is causing this because it's all really correlational. And when you think about the context, like COVID-19, that was like a once in a lifetime experience. And do we have like an equivalent example to like, maybe this is just what happens to people when there's like a mass trauma, and like, it's not really social media's fault, although it plays a role in it. They caution against bias for presenting patients, and usually the people that aren't fitting this, like, you know, by the book definition of like what these criteria are female, and they come from gender minorities, They come from ethnic and racial minorities, right? And so when we're like immediately questioning someone and the validity of their statements, it might lead to this like bias against certain populations. There are established underdiagnosis in some of these things. There are also, this harm-focused rhetoric increases the stigma around it. And there's concerns about gatekeeping and being like, nope, we are the purveyors of these things, and like, you don't own this, and like, only we can say if you have this or not, which isn't always aligned with some of our values, which I'll get into when we talk about ethics. And this paper brought up a kind of interesting thing about the cause of these behaviors might not be relevant when we're thinking of from an intervention perspective, because in their paper, or a couple of papers regarding the tic and Tourette's like behaviors, whether it was like a functional movement disorder or tics or Tourette's, it was like a very similar course of treatment. And so it kind of was like, well, is it always like practically necessary to determine did social media cause this or not, when the treatment is beneficial either way? And then we also have to think about the benefits of technology and social media. But, oh, here's the vulnerabilities. So there are certain characteristics or population traits that maybe make people turn to social media for mental health information. And we know that our healthcare system is really challenging to actually like getting support and like having an official diagnosis or evaluation or treatment. And so these are the kinds of people that might be more vulnerable to this or might engage in this behavior more, having younger ethnic minority status, fear of stigma, lack of trust in healthcare providers, and sometimes that's warranted, and just experiencing invalidation of their experience. But if we go too far the other side, so there are also some studies that look at, you know, types of content and how creators are dealing with the phenomenon of people like saying like, oh, now you're faking it and attention seeking. And that 64% of posters in this study found that they made such disclaimers and had to prove that they had these things. And then they turn around and label this behavior as like cyberbullying. Providers that question this are called invalidating or gaslighting, right? So then we're kind of too extreme on the stance of like all acceptance all the time or nothing. And that also doesn't seem to be helpful. And so we have a wide range that shows up. So let's think about the ethical guidelines and how we might approach some of these sides of the debate. And I pulled the ethical guidelines from not just the APA, because I'm a psychologist, so obviously that's where I went to first, but I looked at the one for social work and for marriage and family therapy and the one for mental health counselors, although they don't have general principles of the one for mental health counselors. They have more descriptive of like what their commitment is to, like commitment to the clients and professionals and things like that. So they kind of structure it a little bit differently. But as you can see, there's some common themes in terms of like integrity and dignity and worth of a person and diversity and equity, integrity, right? So when we think about it, then how can we apply some of those guidelines or principles to this situation? Obviously the Hippocratic Oath is none of ours, but they have the same message of do no harm, obviously. Beneficence, malfeasance. It's interesting that APA criteria has a lot more specifications on not doing harm and like violating human rights than other ethical guidelines do. And I think it's obviously because of, you know, events that happened of like, okay, now we actually really have to spell this out. But the other professions seem to do fine without like directly spelling it out. So that was just, it was kind of fun reading all these. Anyway, I'm getting sidetracked. So the doing no harm thing is really challenging because where does the harm come from in this context? And so that's kind of a question I want to pose to you all as the audience. Where do you see the potential risk for harm in either diagnosing or not diagnosing, or supporting self-diagnosis or not supporting self-diagnosis? And so I want to, hear from the people. Where do you see the harm coming from? Now that I got rid of the control panel, I can't access the chat anymore. So, that is a barrier to me here, seeing all these things that you are presenting, but you all can see it for each other, and maybe I can figure that out in a second. But some potential harm that comes up. Here are some things that maybe you guys also came up with. So if we look at it through this lens of do no harm, again, it doesn't give a clear directive because you could kind of argue it either way. It's like this tension between the two. Then a lot of these criteria, I pulled these guidelines from all of them, really emphasize like trust and the relationship. Not only trust with like your individual clients, but also trust with like the public as a whole. And that I think is important in this context, because if people, one of the motivators for self-diagnosing is lack of trust in healthcare providers, and I feel like that's a problem. And so what can we do to increase the public's trust in us? And think about, and I do have some specific recommendations about that, but that is another component that is relevant to this. And then we think about accuracy in the information. So there's accuracy and information that we're promoting about ourselves, accuracy and information that we're communicating to the clients, to the public as a whole. And so like we really want to be accurate in our diagnosis. This was a big one that was like, I highlighted that all of them, almost all of them, one of them didn't use this phrase specifically, but focus on self-determination. And that's really important also from a self-diagnosis perspective of like people taking agency in their own care and learning more about what's going on with them and coming up, having more of a collaborative stance and discussing these things. So that also plays a role in here. So where do we see the conflicts here? And I'm actually gonna, oh, I found a way to get to the chat. Yes. Yep. What conflicts do you see arising between these ethical principles? I have the chat open now. I can see it. I'm going to kind of go back and look at some of your previous ones. Harm of over-pathologizing experience. We have to have license and training to diagnose, to protect. Yep. Med management, missing a diagnosis. So yeah, tell me more about what conflicts you see between some of these ethical mandates. Can you see it rising? Like, for instance, the conflict, the belief, I am this from clients. Yeah, the conflict of like wanting to treat clients as having agency and self-determination in their treatment. But if they are basing that on inaccurate information, you also want to correct that accuracy, but it could harm the relationship. So you have to do it in a way that enables their trust. And we want to be doing it. It is a dialectic. Thank you for saying that, Marcy, because that's what this is. Sometimes insurances require a specific diagnosis. That's, yeah, I'm going to get into that with the decision making. Autonomy versus integrity. Yep. It is a dialectic. Okay, I'm going to go through and look at what do the guidelines say about managing ethical conflicts, and there's really no clear-cut priority over others. So it's like we're sitting in that dialectical tension. The APA emphasizes that like under no circumstances can we violate human rights, so they hold that one, I think, pretty high. And again, there's reasons for that. The social work organization emphasizes using consultation whenever there's ethical conflicts. And the mental health counselors emphasize using ethical decision-making models, which we'll go through some of those. And the AMFT encourages following the highest standard and choosing the course of action that allows the fullest compliance with the code. So kind of like what encompasses most of these, if not all of them. And so that's the different professional lenses. But let's talk about ethical decision-making. What this means is, I'm going to go through the steps in a second, but there's different lenses or priorities you might view these ethical decisions. And so here are some of them right here, some of them holding up individual choice, some holding up equality, some holding up practicality, values, some focus on the outcome versus on the decision itself, emphasizing relationships. So there's a lot of different ways that you can make this choice depending on what you prioritize. I know for me, when I was kind of reflecting on like, what do I do, even if I'm not realizing I'm like actively making ethical decision making, I sometimes find that I'm pulled towards maybe the utilitarian perspective of like, practically, what would this mean? And, clients need some type of help, and what would be the best way to get them that help? Sometimes I think in that kind of frame. And then some people focus, I think, more on the values of like, no, we have to have the most accurate and strongest argument for whatever. So I think there's a lot of different ways you can use this. So if you're thinking about a specific situation of like this conflict between what the client's coming in with and what you think and what to prioritize, these are the steps that you could walk through. And here's the questions that you would ask depending on the lens in which you're viewing it. And so I think the biggest demarcation is like, are we doing the lens of like, what is the best decision versus what is the best outcome? We always are acting in line with this versus getting to that place. And so that is an interesting thing to think about. And then reflect on the outcome after you select an option, and maybe you will think about a different lens next time, or you'll continue using that lens. But here are some clinical frameworks that I think can help with this tension. If the ethics are like we're holding up all the sides. There's a pretty clear emphasis on the relationship when all of these things, including the ones that are like everyone's faking it, relational strength and rapport is pretty important. So I also just want to say, people can be correct about what they're coming in with. And I was trying to really find research that says like, are people inaccurate when they come to us with these things? Are they kind of accurate? Are they not accurate at all? And that was not really as prevalent in the research, but I did find a couple things. There was one study that did agreement in clinician and client ratings on measures of different mental health symptoms. And they found that there was actually, there's actually pretty strong alignment between how clients and clinicians were seeing things, except when it came to psychotic symptoms, clients tended to over-report those things. And which was funny because the stance of the writers were thinking like, oh, well, clients might under-pathologize because they don't want to share, or there's some guardedness. And it was actually the opposite. And I think we are maybe having the opposite problem of like people over-reporting. Then there was a study that compared how clients use the internet when trying to make diagnostic choices, and the way that they searched for information affected how accurate they were. And this wasn't mental health focused totally, even though I think ADHD and some other things like depression were a component of this. This was like medical diagnosis more broadly. They found that people who generated more symptom focused diagnoses versus doing hypothesis testing were more accurate. So like if you're looking at, I experienced this, and this, what could that be versus do I have ADHD, do I have autism, and trying to focus on a label first. Females tended to be more accurate than males. Younger age led to more inaccuracies, although younger in this context, I think they didn't do teens, more young adults. And then accessing information on the internet overall did improve diagnostic accuracy, especially with the quality of the information, was good quality. No surprise. Actually, there's a lot more research about how we are not very accurate than there is that they are not accurate. And so it's important to keep in mind too, is we're not infallible. And sometimes the self-diagnosis can really enhance the relationship. And there was a review paper that looked at, what are your motivations for using the internet for health information? And found that overall people still do trust professionals more than the internet. And the goals of using the information was to have a more collaborative treatment approach, not to like prove we're wrong. But the majority of the sample kind of like fell in that demographic, white female middle age. So it might not accurately translate to TikTok in specific, but there wasn't specific information about that. But I thought that was interesting. It was like the motivation of the client doesn't seem to be like, this is what I think and I don't care what you think. It does seem to be they're wanting to participate more in their care from a collaborative stance and wanting to like share ideas and hear what we think about them. So yay, they do value us. So clinical modalities that can be helpful in this context, therapeutic assessment is a great one. And this has a process of how to approach assessment that gets the client more involved, and it really focuses on that like self-determination, relationship. So we have them state in their own words what questions they're hoping will be answered. So not just like, do I have ADHD, but just like, why can I suddenly like not get any of my tasks done? Why do I have a hard time getting started on tasks? Why can't I finish my assignments even though I know what I'm supposed to do? Like really what are the functional problems they're having? Do our normal standardized assessments, but then also invite their observations and reflections about like the testing process, which is kind of interesting. And then when you're giving feedback, we're not really giving them finalized feedback. We're presenting the data and what we think, and we're asking how it fits their experience and understanding. And then ideally, we're kind of constructing joint answers to these questions, and they're more likely to receive the information and follow up with the intervention if the approach is done in this way. We can use a motivational interviewing framework, which again emphasizes collaboration versus confrontation. Whenever there's a disagreement or resistance, as they call it, we try to evoke things from the client rather than imposing our own ideas. And it's really focused on autonomy rather than authority. And so here are some principles that show up. So if we're really feeling like they're getting attached to this, it's not going to be helpful to be like, no, that's not it. We try to think about reflecting like, oh, it makes sense why you might think that, and tell me more about that and what you feel like this identity or this label really does for you or allows for you. And try to think about, is there some discrepancy in their values and their future goals by like being so strongly adherent to this thing that is not a good fit. And I always love interpersonal effectiveness as like a DBT therapist. Validation. I mean, all of these things really are getting at validation, honestly. Which, if we need a reminder of validation, it does not equal agreement, but really what it does is increases shared understanding. And so here's different ways you can be validating in this situation. I am a huge fan of the level 6 validation of just like the radical genuineness of like, hey, look, I know why you think this, and I know the information is confusing out there, but like, I really need you to, you're kind of hurting yourself in this thing, and like, can we go through these responses and like, let's think about examples. And I really like that, just being honest. But there's other things of like looking for how what they're going through makes sense based on what they've been through, what the information is they're finding, or just reflecting back what they're saying, right? So there's different ways to kind of help them feel heard. Again, we know this. I'm assuming we'll use these in our regular clinical practice, but just I think in this context could be really helpful. But even if we do find that there is some intentionality behind this, in those papers, they really emphasized it's still important to have the relationship. And I really like this quote about connection, because ultimately that's what this is they are connecting really strongly to this belonging need of this illness representation. And so we want to disconnect them from social media and disconnect them from that maybe like illusory belongingness and think about real life belongingness and how do we support that. And that's kind of where health emerges. Shifting a little bit to the mental health content on social media from other people and from us. There was a study that did examine the quality of the actual information on there, because I think people make assumptions that it's all bad, but they categorized videos on TikTok about ADHD into 3 types: misleading, personal experience, and useful. It was majority misleading based on their criteria, but actually it was kind of interesting what they labeled as misleading, and not necessarily wrong, but I think it kind of gets at some of your guys' feedback from the beginning of like, maybe there's just like mislabeling of content. So I like looked up like what were some of their examples. So for instance, they talked about, people with ADHD don't have object permanence. And so what they're trying to get at is like kind of out of sight, out of mind, but obviously the phrase object permanence means something very different. And so they might be getting at something that is accurate, but saying it in a way that is not totally correct, or communicating that they struggle with, everyone with ADHD has like stimming, which isn't necessarily true, but not necessarily false. Like it's not technically a criteria in the ADHD diagnostic criteria, but we can see that it might be a trait. So it's like, they're not all like totally wrong, but presenting the information in a way that has some inaccuracies. A lot is about personal experience, and then some of it's useful content. The professionals on that space had the most useful content, and non-professionals had the most misleading content. And so the authors, had a call to action that professionals need to be in this space to promote evidence-based intervention and combat misinformation, which, let's talk about how we might do that if we're interested. So one way to do it would be to use it as a way to disseminate research. And there was a study that examined the effects of social media on sharing the article or an article impact. And as you see, like on different spheres, they did not study TikTok in particular, but looked at Twitter, Facebook, and found that it led to more engagement with that research, which is really cool, because people generally aren't just like looking up medical research articles or just have limited access to that. So using social media allows for that, which is interesting. And many of you are doing this stuff already. So like, yeah, share it on social media. This is from a paper from Counseling Psychology, but they have a stance about viewing social media from a cultural lens, and that if we're practicing from cultural competence and ethical practice, we need to be involved, or at least understand this space, and do a self-inventory on what our biases and opinions might be about it, similar to how we would approach other types of culture, which I thought was cool. Like, this is its own culture. It is culture. There is this resource called Common Sense Media that it's really geared for parents, but they recommend using it as a provider. Like if you don't want to download TikTok, that's fine, but you can learn more about it. And I linked the specific TikTok article of like how it's used and what are its features and how do we protect privacy and what are the risks. Like it's like really interesting. So there's a ton of apps on that website that you can go through as well, if you just want the rundown. So at the very least, we need an awareness stance. If you yourself are creating content, and you don't have to create content, that's not what everyone's arguing. But if you want to create content, here are some guidelines on how to get engagement with your videos. And the link to this paper as well as in the resources. But one thing that I found was pretty interesting was that there was a study that compared characteristics of educational videos and engagement, and found that like we kind of tend to be, just really like direct, like here's information, and maybe it's like longer form than shorter form, but really engagement is better for like shorter form, using the sounds and the filters, using humor, and that catches people's attention. And if you do that, you can also mix it up with the more educational content, but using that to be involved in the space to promote reach is important. If you don't want to do content creation or are really overwhelmed by it, you can also participate by like elevating others' content that you find is evidence-based and supportive. Like you're looking through and being like, oh, this page is really cool, or you have colleagues that have like really great content. Like you can participate by promoting evidence-based content, even if you don't create it. But here are the ethical guidelines for social media use. This is from the APA. They have like a specific, here's what you have to keep in mind if you're engaging in social media. So some of it's like adapting other guidelines for this specifically. So I wanted to go through some of these. We have to protect confidentiality, very important. So we're discussing that with clients in terms of like friending or not, or like we're obviously not sharing client information on social media, things like that. And we also have to think about that our privacy is not protected in the social media sphere. So we have to think about like what information can clients find and see about us, and make sure that's accurate, and make sure like we're comfortable with that level of information, and work towards getting rid of that information if we don't want that to be seen. We have to really think about multiple relationships, and think about what that means when we're communicating on that sphere. They say consider avoiding contact with current or past clients, but it might not always be possible. Like if you're just having these content pages and you have all of these follows and shares and engagement, like they might include clients, right? And so you have to also communicate that this is not a clinical relationship, right? And then think about, obviously we're trying to be accurate and truthful and have an empirical basis for all of our statements made and the limitations of the evidence. So this is a sneak peek of, we're updating our guidelines currently at UCBT, but we kind of focus on core tenets of privacy, confidentiality, multiple relationships, accurate and research-based evidence information, and that the social media communication is not the same as a clinical relationship, and that it's really important from this perspective from the APA to discuss the role of social media as part of informed consent with clients. But it also allows some flexibility for individual clinicians' boundaries as well. So it's not necessarily here's what everyone is going to do all the time, but here's what everyone's going to uphold in making their choices. So with that in mind, when it seems like really complicated and dialectical and tensions, it's like, why would we bother engaging in this space? Actually, I took a training on social media and clinical practice, and that was like an option. It was like, you can go totally blackout. You could just not be on the internet. And I don't know how realistic that is in this day and age, but that is, you have that choice. But I think there is an ethical mandate. I pulled all of these from all of the different professions, the social media guidelines, our regular guidelines. I think there is an ethical mandate for us to participate in this space in some way, because we all really emphasize equal access and quality of information and benefiting the community and advocacy and all of these things. And so I think, you know, that's where the people are. That's where our community is. That's where our clients are. And we have to be there. And it's important to combat misinformation online and combat against people like misusing our data or our professional knowledge for, you know, ill intent. So that is what I will say is the ethical mandate here. But obviously, personal choice is important. So I will kind of end there, pause for questions or anything, but just as a reminder to, sign up at ucbt.com to get any updates about our future events. This is our last CE for this year. Crazy, crazy. And we thank you all so much for being really wonderful audience members and participators and engaged with our program. And it's really benefiting our clients too with this sliding scale and pro bono services. So be on the lookout for the evaluation forms and the feedback forms in the email that was sent, and make sure those are completed to get your CE credit. And yeah, there's a bunch of references. Okay. We are opened up for questions, comments, concerns, whatever is needed. I also have the chat open here if you want to put something in the chat.
So for me, it's like information on TikTok is so simplistic and has like a actual theory and whatnot, but only talked in my office with a.
Yeah, I think there's a bit of a connection challenge. So you're cutting out a lot, and I can't really, I can't hear what you're cutting out a lot. So I'm like missing like every other word in your question. I'm sorry.
I'll put it in,
Yeah, you could put it in the chat.
Sorry.
No problem. Yeah, I was like, I was trying and I was like, I don't even think I know what you're asking. I'm so sorry. Yeah. So some concerns in the chat that this is growing in child and adolescent populations. And I think for that case, it's really important to support parent literacy in all of these things. So they can set appropriate boundaries in social media and have these discussions with their kids and teens about the content information on there. So that's part of what that Common Sense Media link is about, is helping parents have more information about this and setting the boundaries that they feel are appropriate. Resources on how to engage in social media around as a provider. Yeah. So there, you know what, I'll update this slide to link the training that I took, because that was a really cool resource. But yeah, there are. And there's a couple of those papers that I referenced that was talking about kind of the tips and tricks. Performance validity tests. Yes. Yes, there are a lot of things. So I am a part of this Facebook group that maybe many of you are also a part of, called the Testing Psychologist group. And there's a lot of discussion in the testing world about performance validity tests and how that can help get accuracy of information or kind of ascertain that secondary gain view. Oh, Carrie, so your concern is that the risk of maybe engaging in this space is that it presents maybe a simplistic view of topics to make it more relatable, but still misses that nuance and the complexity. And so I think in that case, usually what educators or practitioners do in their space of like, when they're creating things, is they provide references and resources for like further information. So you kind of are, again, addressing the limitations. It's like, so this might not be true for all of you, and this might not be that, this can't be like so totally generalized, but here's like a research association of these concepts, and here's further information, and obviously see a professional for confirmation about these things, right? So that's kind of how they're presenting the information. So they're not presenting it as like, everyone who has ADHD deals with this thing, and like, as some of the other content creators are. So there's just like a different lens in which you're presenting. Engaging content has been difficult. Yeah, so there's a couple things on that. Consultation on that, if there's like other professionals that are also engaging in that content, then you can reach out and have support from a you can use social media for that. Is like, hey, how do you do this stuff? And like build a consultation in that way. You can hire a Gen Z intern to like run your TikTok, which is kind of what we're doing. We don't have a TikTok yet, but that's kind of our plan, is to have a TikTok intern. So they're more involved in the space, and like you provide the clinical information and they provide the literacy in this. So that's another example. If you have just like a daughter or a niece or someone or a nephew who can do that. So there's a couple of different options, but yeah, it's consultation and getting help, I would say. Let's see. It looks like there's an issue with the link getting the evaluation form. So we will send you that, don't worry. Thoughts on clients presenting and not wanting to improve functioning. Yes, so I think from that stance, I would move away from the diagnostic label and think about their values and goals. So not wanting to improve functioning, that can mean a lot of things. So like, oh, maybe they're opting out of certain requirements or activities because they're saying like, oh, I have this diagnosis and I can't do XYZ. So trying to think about what is this attachment or identity doing for them, and what need is being met in that way, and how can we meet that need in a way that's more healthy. So it's going to come from more of like again, validating that perspective, probably not so much focusing on the label. And then like, yeah, identifying as this like patient role. And there's a reason why they are identifying that way, because it is meeting some need that in their environment is not getting met. And how can that need be met in the environment? And again, I would not really focus on the issue of like getting them to label or not label. but more think about how we can enrich or like help them live in line with more of their values, and think about how their environment can support them. And then, yeah, so getting in the trap of diagnoses. So some clinicians would have a stance of like, I don't even talk about diagnoses, or we talk about it, but we talk about how it's not that important, of like, yeah, here's what it is. But what's important is like, what are your problems in living and how can we help you with them? So you can shift to discussion away from that. Oh, someone had a question earlier, a thing about, I had a thought I wanted to follow up on about sometimes diagnosis is necessary for medical coverage. And yeah, that is an ethical dilemma as well, of like, is this accurate or not? But also they won't be able to get help or not, you know, like what's that tension? So yeah, sometimes we have to explain to clients, sometimes these labels are just necessary for the functioning in our system, but may not totally capture all of their experience and what that means for them. Okay. Yeah, TikTok avoiders. It's not that bad. Oh, I don't know. I would recommend just not getting on there because you'll waste a bunch of time on there, but I love it. So I'm on there all the time. Okay. Well, I'll obviously hang out for the next few minutes to see as other questions come up. But we're going to send the recording and slides out, not immediately, but a week or so. And we're available, yeah, to connect if you have any further questions. Thanks so much for everyone's engagement and for attending today.